I'm Madison, and this is hip dysplasia. So what is hip dysplasia? The definition is it is a developmental orthopedic disease characterized by abnormal formation of the coxofemoral joint, which is the hip joint. And this photo here is usually what is a symptom of hip dysplasia in dogs. So normally when you see dogs laying like this, they may have hip dysplasia. So organs of interest, there's really no organs associated with hip dysplasia, but definitely the coxofemoral joint, as explained before, the hip joint, is directly impacted and is located in the caudal portion of the pelvis, on the right and left lateral to the spine and right underneath the lumbar vertebrae. And is it acute or chronic? And it can actually be both acute and chronic. And it's usually shown by physical exams and x-rays. In the acute stage, it will present itself with intense hip pain and lameness. And in the chronic stage, it can become chronic after it's acute. But it will continue to be painful, and it leads to reduced range of motion and secondary osteoarthritis. And the importance, there's major implications for the dog's health, the quality of life, and long-term mobility. It is very common in larger breeds of dogs. It's challenging to treat, and it's partially preventable. Again, this all just depends on the severity, the age of onset, and the dog's size and their activity levels. But once damage occurs, it really can't be reversed. So really treatment is focused on just managing pain and slowing degeneration, and not the same treatment can't fix all dogs because they're all so different. And again, usually the treatment options vary from mainly just medications and surgeries. So some symptoms here, hypertrophy, which is the enlargement of certain muscles to compensate for the joint instability and the pain, and atrophy, which is more common, which is the wasting of the muscles directly associated with the affected hip joint. There's intense hip pain, and there's pain during full extension and flexion, which may be present. And dogs will also do something called bunny hopping, basically just moving both their hind legs at the same time, creating a bunny hop type of movement. And the specifics, is there inflammation? Yes, especially in degenerative joint disease and osteoarthritis. And it occurs in the coxofemoral joint. This is typically called arthritis, but it's normally recognized by pain, stiffness, swelling, and behavior changes. And the diagnostics, usually it's done by physical exams, a urinalysis, palpitations, and radiographs or x-rays. And usually if they're going to take an x-ray, they will do it from the ventrodorsal extended hip view. And here you can see that exact view with these x-rays. On the left is what a normal hip would look like, with the ball and sockets. Everything is aligned correctly. And then in the middle is moderate dysplasia, where you can see the sockets and the joints are kind of dislodged from each other a bit. And in severe dysplasia on the right, you can see that they're almost totally dislodged from the socket. And then here are my references.